As a parent of a young adult with IDD, ASD, or behavioral challenges, you have probably come across treatment plans that included the use of restraints. You might have implemented one of these techniques to keep your child safe or to facilitate a medical procedure. Perhaps you've even seen this method be used by employees in a school or daycare setting. However, what are the effects of years of previous use of restraints on young adults? Are they absolutely necessary during their adulthood? More importantly, can you prevent the use of restraints by police officers when they are called to assist your young adult during a crisis? Treatment at CBSS is based on the ethical guidelines that are covered by the Behavior Analyst Certification Board. Through these ethical codes of behavior, we will explore the use of restraints when it comes to the health and safety of your adult child, specifically when they engage in self-injurious behavior, property destruction, or aggressive behavior towards others. This presentation will go over types of restraints, clinical recommendations, the effects of using restraints, training and education of restraints, alternative treatments, and the different approach that is used by CBSS to prevent and stop problem behaviors. If your young adult has displayed problem behaviors in the past, you might have been advised by a medical professional, educator, or therapist to consider one of the following restraints. A mechanical restraint, which is achieved by applying a restrictive device such as a vest, a straitjacket, a glove, a helmet, or any other kind of device that was created to restrict a person's movement. A chemical restraint, which is a medication that is used in order to control aggression or excessive verbal outbursts that are usually made up of a sedative or antipsychotic drug. A physical restraint, which is composed of physically holding an individual in order to stop movement. All of these types of restraints were created in an attempt to help keep an individual or others safe from harm. These are the three types of restraints that are used in mental health. One of the problems with growing up with the use of restraints is that your child will eventually turn into an adult, which means the mechanical, chemical, or physical restraint will need to increase in strength in order to be effective. So why is this a problem? Resistance to sedatives and antipsychotic drugs as your child grows would mean increasing doses, trying different medications, or combining more than one kind of drug in an attempt to come up with the perfect medication cocktail. Destruction of mechanical restraints is another challenge that arises as your child grows. Stronger material, longer use of restraints, or new additions to the original design in order to prevent removal or destruction of the mechanical restraint become necessary. A physical restraint is fairly easy when you are significantly larger and stronger than your child. However, what happens when your child is a full-grown young adult? If your adult child attends a day hub, the number of employees that participate in a restraint during a crisis usually increase when one staff member is not successful in administering the restraint. Once multiple staff members are required to provide extra support, the day hub will normally reach out to the police department for further assistance. Police officers will use the necessary means to protect others and/or to stop your young adult from harming him or herself during a crisis. It is not uncommon to observe cops use mechanical restraints, such as face masks or handcuffs, along with physical restraints that are implemented by more than one officer in order to stop your young adult from being able to move. This type of interaction with police officers leads to the avoidance of interaction with other cops under different settings and circumstances. Instead of learning to go to the police when they are lost, in danger, or in need of assistance, your young adult has learned to associate the police with punishment. Likewise, every time a familiar person places your child in a physical restraint, that person risks the chances of destroying a previously healthy relationship with your young adult. Let's take a look at how the use of restraints causes changes for both parties that are involved. For the one getting restrained, there is usually an increase in the rate of problem behavior. In other words, although the problem behavior used to be limited to one specific behavior that would occur under certain situations or settings, after implementation of restraints, you may see a spike in behavior. The behavior may now begin to be displayed across different people, places, or circumstances. Some individuals even begin to engage in brand new problem behaviors, such as placing peers or family members in restraints. Restraints don't work immediately, and they don't provide an alternative to the target behavior, which is why there is often a manifestation of emotional despair when they are used. As for the person implementing the restraint, research has found that stopping the behavior becomes reinforcing and therefore increases the number of times that it is utilized. Unfortunately, sometimes the restraint starts to be used in order to stop other behaviors on top of the target problem behavior. The continuous application of a restraint often leads to a decrease in the level of trust and safety that the person administering the restraint had previously built with the individual. So, how do we minimize the risk for both parties? In order to minimize the side effects of restraints, CBSS strives to serve as a pool of education for other members of our community that work with young adults who are diagnosed with IDD or ASD. All trainings are conducted by a certified trainer who follows the ethical codes of behavior set forth by the Behavior Analyst Certification Board. CBSS follows ethical codes of behavior which emphasize that all treatment plans be based on the best interest of all of our clients. In other words, CBSS will only implement a training for the use of a restraint after obtaining authorization and creation of a plan on how to eliminate the use of the restraint as quickly and safely as possible. CBSS will focus on understanding the function of the problem behavior, teaching alternative appropriate behaviors to take the place of the target behavior, utilizing positive reinforcement to shape socially acceptable behavior, and relying on scientific-based interventions to prevent the use of restrictions on your young adult. CBSS offers a different approach to problem behavior, a way to provide long-term results instead of temporary results that more often than not do more harm than good to your young adult. CBSS makes changes to the environment through the science of applied behavior analysis while focusing on the dignity, health, safety, and future of your young adult. Together, we can strive to create a better way to handle problem behavior during your young adult's time of crisis. Thank you for taking the time to watch this brief presentation on the side effects of the use of restraints. For more information, reach out to us through email or call our office.